Good evening, friends. Happy Friday. You can hear the dulcet tones of the laundry going in the background. That's how you know that my wife and daughter are coming home tomorrow. It's very impressive to me to learn just how many features of my personality are performative, apparently, that I only do when someone is watching. I would have told you that I do most of the cleaning around my apartment. I think that's true. My wife does the tidying. I'm a slob in terms of leaving stuff out, but I like clean the bathroom and the kitchen counters and do the dishes. You get the idea. I cannot properly communicate the level to which that has completely disappeared since she has been gone. It's really impressive how dirty I really am deep down, and how much me cleaning the apartment is clearly just signaling to my wife that, like, it's okay that you live with me. I'm not a filthy person. Spoiler, I am. That's okay. She just told me she actually stopped watching these when I stopped working inpatient, so I can really talk trash now, and all those nice things I was saying, they're still true. They're still true. She's wonderful. I don't know what to tell you. Portia is thinking about a jump up, just so you guys aren't scared later. She jumps into frame. Been a long week. I will be working the weekend a little bit, just on call for that army of recently graduated MDs I mentioned before. Shouldn't be so bad. Shouldn't be a ton of volume, but I do have plenty of catching up to do from last week, unfortunately, and I won't want to do any of it because I will have my daughter back, and I'll want to just do nothing but spend time with her. So that's fine. There's no ticking clock here. The catching up can happen eventually. Not soon, but eventually. It's tough, man. That's the thing about primary care. You know, it's paperwork, and it really is the infinite to-do list. And if you are the kind of person who likes to keep a to-do list of 0, you have to learn to either you have to really good delegation, really good nursing and other staff, and I do have some of that for sure, or you also have to be willing to call it good enough with a couple of tasks if you're trying to do everything fully. Like, if you're the kind of person who actually reads the home care orders when they're sent to you by the home care company and makes corrections. Not anymore, but for like my first, I'm going to say year and a half out of residency, I did. That way lies madness. You can't do that and survive. It's just not practical. It's just not built for that. And I actually have data to back that up. There's a paper in Annals in which I think the majority, and I don't want to quote a number because I'm going to be wrong, but I'm almost certain it was the majority. I think it was an overwhelming majority of physicians said they changed home care orders less than 1% of the time that they read them. So there's an infinite amount to do. And you gotta do it as best you can. You gotta make sure the things that fall through the cracks are things that won't be missed, which is a process of trial and error, unfortunately. As I said, right now the cracks are wider than they've been in a while because a lot of my colleagues are helping out inpatient, and they are doing important work, as I did for 2 weeks inpatient. Important, but incredibly less efficient work than we do on the outpatient side. There's some argument to be made. Certainly it's less cost effective per quality adjusted life year, but that being said, it's literally saving a life right in the moment. It's very tangible, the inpatient work, whereas the outpatient work, you adjust 1,000 things to maybe make a difference in 1 or 2 cases that you'll notice. It's all about the number needed to treat, right? But, like, you know, over the last week, I have touched the care of, it has to be over 200 patients, and it's probably more than that, either directly or indirectly through calling them or through talking to the residents or students who spoke with them. I would be very surprised if it were not 200. On an average inpatient service for that week that I was on that same, let's say, 5-day period, I carried between 16 and 18 patients a day. And many of those were the same patient, but even if you count that across 5 days, that's half as many patients, slightly less than half. And again, they were the same patient multiple days as well. So again, it's not a competition. I'm just saying that, like, I shouldn't be frustrated by the way that we're distributing our labor. Coronavirus is scary, and it's that same thing that I talked about before. Several thousand people die, and we go to war for 17 years. Sorry, 19 and counting. Whereas thousands and tens of thousands of people die from preventable disease every year, and there's not a similar mobilization. It's not the same. I understand that it's not the same emotionally, and it's not the same in terms of how those events are felt. Deaths inpatient from coronavirus are felt very acutely by everyone in society in terms of fear, whereas decreased control of diabetes resulting in a case of diabetic retinopathy and blindness 10 years from now is not felt in the same way. But if we are just playing the numbers, which to some extent we must do if we're going to do population health and really try to take care of everyone, we need to be staffing outpatient aggressively right now because people are out of care. So we need more phone calls, we need more everything, not less. Again, our clinic is doing great work with what we have. We're all stepping up and working crazy hours and doing an amazing job, but I'm sure other offices aren't, especially single proprietors, like single doctor PCP offices in the community. I have no idea what they're able to do. I just don't know what they're staffed for. Can they suddenly make a robust telemedicine program? I suspect not. Certainly from some of the patients who are discharged from the hospital, I'm hearing that they're having a tough time getting a hold of their doctors, and that's a structural problem. That's not that doctor's fault. It's just, what did you expect? Anyway, this got more frustrated than I meant it to. There's just a lot of work. It's good work. I like it. I told you, every time I call someone and talk to them, I just want to adopt them as my patient and get to see them however often and whatever else. They're really nice humans for the most part. And the ones that aren't are almost always because they're suffering in some way. They have untreated substance abuse disorder, or they have untreated psychiatric disease, or they are just under such incredible social stressors due to poverty or domestic abuse or whatever else. Almost no one is a jerk just because they're a jerk. The word almost is doing some work in that sentence, I can admit. I feel as though this is going on long. Since I switched to cameras, I no longer have the timer in front of me, so I'm just going emotionally. Has this been about 5 to 7 minutes? And I feel like I might be at about 7:15. If I'm right on, you're going to freak out when I post this video. I can edit it, but that seems like a lot of work, so I won't. Anyway, it's Friday. I hope you have the weekend off, and I hope you get some rest on the weekend that you have off in my fantasy. I'll be working a little bit, but more importantly, I'll be seeing my family, and I am very, very excited for that. Thank you all once again for tuning in and listening to what I have to say. I hope it's interesting. Thank you for those who've left comments. I enjoy talking to you and talking about what's going on. I don't really want to talk about injecting bleach anymore. Thank you for those who have asked. Yes, it's crazy. Yes, crazier things have been tried. No, that doesn't mean it's less crazy. Have a good night. I know I will.